Shetye, Director, Vision Hospital. You are all must be knowing Vision Hospital. We have started way back in 2012. In fact, I started my practice as a eye specialist in 8th November 2002. Had a clinic for 2-3 years. In 2006, I started a super specialty eye hospital. I can proudly say I am the only doctor, first doctor in Goa to start a super specialty eye concept. What I mean by super specialty, at my Vision Hospital, we are around 6 ophthalmologists. Each one does a super specialty one. Like I do only a cataract. Then we have a team of retina doctor, Dr. Sachin and Dr. Noor. Team of a glaucoma doctor, Dr. Abhijit and Dr. Ritu Jyoteri. Oculoplasty doctor, Dr. Audrey. Pediatric ophthalmologist, Dr. Milin Kindeda. So each branch there is. In 2012, I started a multi-specialty hospital. The main aim of Vision Hospital, starting a multi-specialty hospital, is to provide affordable and quality service under one roof. Though we are trying our best to give the corporate service, our treatment or whatever other things falls in like an individual proprietary hospital, rather billing I will put it. Today is like the important step. Today we are partnered with Sunrise Oncology Center. Sunrise Oncology Center, which is its main branch is in Mumbai. And they have many centers. They have got already one center in Goa in Esther Hospital. Now this is their second center. The main aim of starting a Sunrise Oncology is to provide a comprehensive oncology care. In Vision Hospital, we have got already 2 onco-surgeons. One Dr. Pawan Rane, who has already passed out from Tata. He's been working with us for the last 4 years. One more doctor, 1 year back, Dr. Adish Palekar, who is the MCS onco-surgeon. But here we used to do only surgical part. There was after follow-up, there was no treatment like chemotherapy treatment, whatever medical oncology said. That treatment was not there. We had some other hospital. Now, with the tie-up with Sunrise Oncology, we will be giving this treatment. And this full floor is the 5th floor of Vision Hospital. It is dedicated to daycare oncology center. So Sunrise Oncology Center, their team with me, around with me is Dr. Prabhas, who is the HOD of medical oncology in Tata Hospital. With me, Dr. Ashray is there, Dr. Bharat Bosle is there, who are partners in Sunrise Oncology Center. Both are ex-consultants from Tata Hospital. So this is full team is from Tata Hospital. They will be visiting Goa every weekly or every 15 days and full treatment they will be taking. Now how they will manage this oncology center further on, I will hand over to Dr. Prabhas, who is a director at Tata Hospital. Dr. Prabhas is a well-known faculty who is known not only nationally but internationally. There are a lot of publications to his credit. Both these consultants, they are well known not only in Mumbai, they are known in full India and outside India also. Hand over to Dr. Prabhas. And then travel after. In fact, today morning also I did one camp at Venla Kanta. So when we go to this outreach camp, same camp I make this awareness. Yes, we have started an oncology center. If possible, I take my onco-surgeon or oncologist. And all this awareness will be done there. And I will be telling them that if you have these symptoms, you can come, you can do a health checkup there. There are cancer markers are there. Okay, to detect. You ask that one question, is there any health checkup? So those are there. Or sir told you all the complaints from there. If you have a small ulcer in mouth, non-healing. Problem with cancer is what? We have a lump or any problem. And if it is not giving pain, even the educated class forget about it. Believe me, last week one lady came. Educated bank officer she came. Because she didn't have a complaint, last month, she didn't come. Now she came because she just found that, okay, so days I will go and do. And believe me, now it is grade 3 to 4 stage. Educated lady, very affluent. It's not that money is an issue, nothing is an issue. So people are there, our problem is there with all of us, including our doctors. See, why? Now people when they have a gastritis, they go to the hospital. Please take a CT. So they are aware of it. It can be happened. Previously it was not like that. People used to say you are complaining of burning, so they will not see it. So what I am going to do, since we have a full team of a doctor, we are taking camps. I have been doing camp almost in every 4-5 villages and all. I am well connected to all these villages. I have peripheral clinic in full Sindhudurga. We are trying to catch Sindhudurga. I have a clinic in Doramar, Banda, Reti, Vengula, eye hospital, Pura, sound audio. So I can do this. So definitely awareness is
medical oncology at Duler Mapusa Hospital, and I need to congratulate Vision Hospital and the Sunrise Cancer Center for coming together to provide comprehensive cancer care in Goa, which has been a huge unmet need for this area. I have known my colleagues in Sunrise Cancer Center for last many years, and I do know that they provide comprehensive and compassionate cancer care at the center which they are working in, they're driving it and improving upon. I am sure in Goa also this partnership will deliver the comprehensive and compassionate cancer for the patients here. Why it is important is because cancer is an important problem, considering that overall in India looks like non-infection cases is on rise as compared to infection. Cancer is one of the non-infection causes for morbidity and mortality. So for that cancer number increasing, we need to have the centers with good infrastructure and with the trained manpower. An important what I use the word comprehensive and compassionate, meaning that there are multiple aspects of cancer care apart from only providing treatment, which is integrated in this concept of providing the comprehensive cancer care, and the compassionate because we have patients with all strata coming up for cancer care, which this partnership will be able to provide. So my best wishes to this partnership to flourish in Goa and all around. Thank you.
Director Sunrise Oncology Center, which is currently operational in Mumbai, Thane and Goa. First of all, I'd like to thank you, Dr. Kumar Prabhash, Head of the Department of Medical Oncology and Professor, well-known researcher, for gracing this occasion, which is an auspicious beginning, I will say. And I would like to thank you, Dr. Shetye and Team Vision, for providing this platform for whatever the good cause we are actually, as a team, we are planning to do in Goa. So as Dr. Kumar Prabhash sir has rightly pointed out, cancer is just not increasing in India as well as globally across. And now we have realized that it is one of the major health problems. In WHO, we have various, we have things every year, and one of the things was sitting is a new smoking. We always know that smoking, tobacco, all these things they can cause a cancer. But again, obesity and other things, they also can cause a cancer. So these are the most vital important things which we are noticing. Most important thing is that when the obesity, the commonest cancer which we look is in females, breast cancer, ovarian cancers, and even in the males, the colon cancer. So all these cancers are very common. And when we actually reviewed the literature from the Goa, definitely we do not have a very concrete registry so far. But whatever the literature which we have reviewed, the stomach cancer is one of the commonest cancer in Goa. Again, head and neck cancer, which are common cancers, the colon cancers, in female, the breast cancers. So majority of these cancers can be identified at an earlier stage, number one. And if we could identify at an earlier stage, we can cure them completely. See, the traditional myth is there that cancer is not curable, which is no more actually valid. But the thing is that we have to create this awareness. So through Vision, as Dr. Kumar Prabhash and Dr. Shetye sir has rightly pointed out, it is going to be comprehensive healthcare. So it is not just aiming at coming here, seeing cancer patients and writing a treatment. It is just to even create awareness among the population in Goa about the cancer symptoms, how we can have a screening programs, how we can have early diagnosis, how we can have prevention. So something that is called as a preventive oncology. Sir is already having many screening camps for cataracts, even for the blindness. So using the same media, we can even have the cancer screening camps. So definitely we are even vouching for that also. So over the period of time, we are going to have all these cancer awareness programs as well as cancer screening programs. Definitely again, they are also attached to many NGOs, and they have actually quite outreach, just not in Goa, again in the adjacent part of the Konkan belt also. So all these patients which are there catering, Vision Hospital already has that network. What as a Sunrise, we have the benefit of utilizing the Vision Hospital's network and providing these services at the best. here we are just as Dr. Chandrakant Shetye sir also, I was discussing with him, money should not be a hindrance to deliver this treatment to the needed patients. So definitely the Goa government also have a Deen Dayal scheme, which is really prominent to even deliver cancer care. Just not through the this system only, but also we can have a team of social networks, NGOs, where we can provide this treatment at affordable price. Of treatment, but what I'm going to say, access to a quality care for everybody, irrespective of whatever their socio-economic strata is. So that is what is the main vision through this joint venture. I really am looking forward to serve the people of Goa through this venture with the Vision Hospital, and definitely looking forward for all of you to create awareness in the people of Goa and working from them in the future. Thank you very much. Body just suddenly started increasing.
This is good thing that people are getting aware. That is the first step in the awareness. People take an example of oral cancer. We start from oral cancer. So oral cancer in India, if you see, now we are starting looking at our own data. And there are publications right from 2012 Lancet, the biggest journal. So India is 40% cancers, which is main state is oral cancer, which is directly related to the use of tobacco. So early detection is important. And prevention is important. Prevention is difficult because addiction, so immediately we know what difficult. So that has to be bombardment through social media, advertising. For those who are tobacco chewers, at least an oral examination, visits, something abnormal happening in the oral cavity can detect the cancer in early stages. Obviously, that needs a surgery, which comes with the comorbidity and patient disfigurement. But it should start right from education to stop the tobacco use. If at all somebody develops such changes in the oral cavity early, that needs to be identified. This is for oral cancer. Cancer, which if detected in the early stages, the cure rate goes beyond 95%. Some of the cancers can be cured with 99%. What is important to come forward in early stages? The good thing about breast cancer being an external organ, if the female knows what are the normal physiological changes happening, then only she is able to pick up something abnormal in the breast. So suppose breast lump or the nipple retraction or blood coming out of nipple, some color changes happening in the breast which are not normally happens, which are persistent, not disappearing with the menstrual cycle. In that case, female at least can go to a concerned physician, family physician, and in the right time if that picked up in with a smaller size without spread, surgery only it can be cured. There are therapies or diagnostic tools which can predict that this patient does not require chemo. This patient, even if the tumor is small, requires chemo. So the science has led it to such a stage the treatment even for breast cancer with same patient will be different. But cure is possible only when it is detected. Lung cancer being an internal organ and which is directly related to tobacco smoking. Not only tobacco smoking, the chula smoke, the burning of the pollution. Because lung cancer happens in non-smoker substitute. There are trials where you can do screening CT scan, but which is largely not possible because you need excellent CT scan centers where the radiologist is also trained in detecting those small nodules. But the things which can prolong the life in stage 4 lung cancer also, for which you need to investigate those patients with lung cancer with the radiology, the biopsy, and the right time referral is also important. So for lung cancer, somebody who is coughing for longer, in India tuberculosis was common. So every patient used to get the tuberculosis drug, and when the lung changes used to spread to other parts of the body, then the biopsy used to happen. But every chest physician is also aware if the cough is not responding to traditional anti-cough measures or tuberculosis treatment, then immediately it should be discussed and the biopsy should be done. And sometimes we are able to pick up those 10-20% patients which can be subjected for surgery and can be cured. So there are cancers which can be picked up. Yes, as you rightly said, but people should know what are the early signs.
So if you get certain symptoms, then only you go and consult the doctor to talk about that, okay, this is
anxiety is very deadly. Sometimes people think that मैं डॉक्टर के पास जाऊँगा तो कैंसर डायग्नोज होगा and then I will. This is not only lay for people, knowledge. I have seen happening with the doctors also. They have kept the breast lump hidden and that had already spread to other parts of the body. The main thing is that if you come to a doctor in right time, this can be cured. And this is possible. You know, science has even in last 10 years, there are tremendous research has happened. What was not available 10 years back, it is available. And I am telling you, lung cancer in 2005, there are hardly any therapies beyond chemotherapy. The survival was 6 months, 8 months, not beyond that. It was actually a scientific thing I thought. And now.
Richard.